the types of bone fractures. Now really pay attention in this part of the lecture because I can specifically remember questions about types of bone fractures where you're given this description and you have to select what type of fracture it is. Okay, so whenever you're analyzing these scenarios, you want to be asking yourself these questions. For instance, number one, did the bone break through the skin? And a fracture where the bone breaks through the skin, as you can see here on the left, is called an open fracture. It also has another name called compound fracture, so remember that. However, on the flip side, you can have a fracture bone that does not penetrate through the skin, so the skin remains intact. And that's called a closed fracture or also called a simple fracture. Then ask yourself, is the bone completely broken or part of it? Now, if the fracture completely separates the bone in two, so you have two separate bones now where it was just one, that is called a complete fracture. So think of it like this, it completely breaks in two. Now, if on the right over here, if the fracture does not break through the bone all the way, it just halfway breaks it, it's called an incomplete fracture, so it incompletely broke it. Then you want to look at the details or the pattern of that fracture. And over here on the left, we have a green stick fracture. And this is where I was talking about where this is one of the most common fractures in a pediatric patient, again, because their bones tend to be a little bit more flexible and stronger. And this is where one side of the bone is bent while the other is broken. And it's an incomplete type of fracture because look, it didn't completely separate that bone in two. Then here on the right, we have a comminuted fracture, and this is where the bone is broken into many fragments, like 3 or more. Then we can have a type of fracture known as transverse fracture, and this is a fracture that is straight across that bone shaft. Then flip it over on the other side with the picture on the right, which is oblique fracture. And this is a type of fracture that is slanted across the bone shaft. So it appears oblique slanted. And lastly, we can have a spiral fracture. And this fracture twists around the bone shaft. And this can be from one of those twisting type injuries when we talked about the causes